Hi, everyone. Thank you for joining us. As Abigail mentioned, my name is Diana Palayo. I am co-director and attorney with the Cancer Legal Resource Center. Today's presentation will be focusing on navigating health insurance. Just as a general disclaimer, the information provided during today's presentation is general legal information. It's not legal advice nor a substitute for legal advice, nor does it establish an attorney-client relationship. Next, I want to talk a little bit about my organization. So the Cancer Legal Resource Center is a program of Disability Rights Legal Center. We are based in Los Angeles, but we provide our services nationwide. The CLRC operates under the educational model. That means we do not provide legal advice or direct representation. Rather, our goal is to provide information and resources on cancer-related legal issues to anyone affected by cancer. Our services are confidential. We have resources in English and Spanish. We also have a language line interpreting service for additional languages. One of the ways we provide our services is through our free telephone assistance line. You can submit an intake online or leave us a phone message to have someone call you back and help you fill out the intake over the phone. We also have many fact sheets on a variety of cancer-related legal issues on our website, including a resource called the Patient Legal Handbook. The handbook provides a brief overview of some of the most common issues and questions that people living with cancer and their families have. This is available for free download on our website in English and Spanish. We also provide bulk physical orders. And lastly, we conduct presentations throughout the year. Often, we do get questions of what are cancer-related legal issues. So before we get started on the presentation on health insurance, I just wanted to highlight some of the common cancer-related legal issues. The first three that are bolded tend to be the most frequent questions that we cover. As you'll know, health insurance is in the top three. All right, so just a brief overview of what we'll cover. It's divided into three parts. We'll start with insurance basics, then we'll start with health insurance options, then we'll move on to health insurance options, and then health insurance appeals. Okay. So under health insurance basics, the first part is understanding your policy. It is the patient's responsibility to understand his or her insurance coverage. People tend to look at doctors and other healthcare providers to know sort of everything about the health, including insurance coverage. But they're not necessarily the ones who are responsible to make sure that the recommended care is covered by the patient's insurance plan. That's why we always say it's important to note that it's the patient's responsibility to understand their coverage. Having this understanding can help sort of plan ahead for finances and avoid unforeseen costs. So what are the types of insurance and plans? So we group them in two ways. There's private insurance and a public program. So a private insurance is something that someone may receive from their employer or purchase individually, say in the marketplace or through an insurance broker. There are different types of insurance plans. Insured and self-insured, that really comes to play when you're thinking about appeals. That's important to know. And then grandfather plans is a remnant of the ACA's early adoption, some of the plans that still existed at the beginning of adoption. Then there are public programs. So we have Medicare, which is a public program insurance for people who have been receiving SSDI for 2 years or more, or are 65 and older. And then there's Medicaid. In California, we call it Medi-Cal, which is why it's listed as Medi-Cal on the slide. And it's an insurance for people who are low income and meet other certain requirements. And we'll touch more on the public programs towards the latter part of the presentation. All right, so the next thing to understand are networks. So the type of network that you have under your plan is important to understand. For example, in private insurance, as well as certain Medicare Advantage plans and some Medicaid plans, they can be called managed care plans. And that's important to know when you're looking at networks. So first, let's start with an HMO. An HMO is a health maintenance organization. Usually they have limited choices for members, limited choices in terms of select doctors and hospitals within a particular participating group. That's why they tend to be less expensive than a PPO because choices are limited. There can be two types of HMOs. The first can be what's called an independent physician association. So physicians practice in their own office, belong to a group. You can think of it as something like Blue Cross. The second type of HMO is a standalone facility. So an insurance company's hospital that you visit for all your care, you can think of something along the line of Kaiser. So the second type of network that we like to talk about are PPOs, and that stands for Preferred Provider Organization. It's a network of providers that's less limited than HMOs, and physicians can be reimbursed at higher rates. They also allow for bigger access to specialists if that's a concern for somebody. You know, an HMO network may not have that many specialists or even the one that the patient wants to see, whereas a PPO may allow that latitude of selecting different types of specialists. Next is a POS, point of service. These plans combine aspects of an HMO and a PPO plan where you would, a patient would get their primary care physician to make referrals like an HMO, but there may be some freedom of choice in providers, even out of network like a PPO. And the last one that I'd like to mention is an EPO. It's an exclusive provider organization. These have been popping up a lot on the marketplace. So in this EPO, the patient may be allowed to use doctors and hospitals within the network, but no out-of-network benefits. This may not be the most economical choice if someone doesn't like the network or the types of restrictions that these plans have. All right, so where to find a policy? There are a couple of places to look. The first is the summary plan description and the evidence of coverage booklet. This may be found on the plan's website. If someone has employer coverage, you still may have access to the plan's website. In addition, if it's an employer-based coverage, they can contact, you might be able to contact the Human Resources Department. Then there's the actual health plan itself, the health plan contract. That's a way to look at some of the terms and conditions of the plan. As I mentioned, HR department. Another thing that we know about state and federal law is even though there is a contract, right, there may be certain provisions that supersede the contract regarding required preventive screening, for example. All right, so now we know where to find the policy. There's going to be some terms that are important to note when looking at a policy and shopping around, either for a new plan or to understand a plan, already existing plan. So the first term we'll start with is a copay. So copay is a fixed amount that someone pays for a covered healthcare service. It's usually paid when the service is given. It can be an office visit or a specialist visit that has a fixed copay amount. It's helpful to get familiar with the different types of copays for services, just again to understand costs that might come up. The next is the deductible. So the deductible is the amount that someone has to pay each year before the health insurance plan begins to pay. So for example, if someone has a deductible of $1,000, the plan won't pay anything until the patient has paid $1,000 for covered services. So that means, the first couple of visits may be out of pocket. The following item is coinsurance. It's usually the amount that it can be a little bit surprising. So most insurance, not even the best insurance, doesn't cover 100% of the cost of the visit. So some people may have a coinsurance, which is the patient's share of the cost of a covered healthcare service. It's usually calculated as a percentage. So if someone has paid the copay and they get billed a random amount for a particular service, it's possible that that's a copay. Co-insurance. So once someone meets the deductible, it's possible that they may also have a co-insurance on top of a copay. And then these final two are also important. It's important to know whether or not certain procedures require pre-authorization. A patient may have to get their doctor to submit a prior authorization or pre-authorization to the insurance company in order for a service to be paid. Just because someone gets something pre-authorized, it doesn't necessarily mean that it will ultimately be covered, but it's better to get something pre-authorized but not getting something pre-authorized when it's needed can create some challenges. And this is usually required for expensive procedures like MRIs. All right. And it's also important to understand limits. I'll use physical therapy as an example. Some plans may limit to say 20 visits per year, while other plans may allow an unlimited number of visits, but you may have to see a doctor periodically for sort of like a prescription or to get a renewal of visits. So it's really important to understand the plan's rules about these services that you may need. Okay, so it's also important to understand your coverage, and sometimes that may be asking for some assistance. So patients can check with their insurance companies to see if they offer a case manager, an insurance case manager, someone who could help you manage, coverage and other issues relating to insurance. If that's something that is not offered by an insurance company, it can also be helpful to have a regular contact or have a go-to person, sort of just to create that rapport and not have to sort of re-explain the story each time someone calls. The second thing that can be really helpful is taking careful notes of each phone call made. So date, time, any numbers, reference numbers. This can be helpful in just keeping good records. When it comes to pre-authorizations or prior authorizations, it's also helpful to get a copy of those prior authorizations, especially if an issue of appeal comes in regarding a prior authorization. It's good to maintain that in your records. And then the last part is to remember that billing mistakes happen. So it's really important to open all medical mail and then review all bills, double check to see if there's any mistakes or any issues with the charges. Sometimes a simple phone call can help whenever these mistakes occur. We also have a handout on our website with some helpful information about medical billing and some webinars that touch on the subject. It's also really important to optimize your health insurance or optimize health insurance. So asking questions with your doctor, either writing down some notes or asking to record, or asking someone to come with you. A lot can happen in a visit, and it can be hard to keep track of it. So having a way to document and keep track of the information that's said in a visit can really help sort of understand and optimize health insurance. The second part is about second opinions. It can be helpful to ask for a second opinion regarding a particular treatment. It's also possible that it may be covered by the insurance, and there are some organizations that can assist with securing second opinions. Okay, so I find it very important to talk about the ACA when we're talking about insurance basics. The ACA prevents discrimination based on pre-existing conditions. This has been in effect since, for a while now. The ACA was passed in 2010 and was fully implemented in 2014. The most important, of course, being this protection for pre-existing conditions. So what's important to know is that health insurers cannot consider health status, medical history, genetic information, or gender when setting premium rates. They can only consider whether it's an individual or family plan, the age of the person, and rating area, which is geographical location. So say, a big city versus a rural area. Furthermore, I like to include an update on the Affordable Care Act. It's still a question that people ask is, has the ACA been repealed? And it hasn't. This question emerged after the tax reform that occurred in late 2017, 2018 about the individual mandate penalty being repealed. So just for clarification, it repealed the penalty, but the ACA was not repealed. What that means is that there's no penalty for 2019 and forward, but some states have their own individual mandates, like California. So it's important to be aware that federally, there may not be a penalty, but some states may have their own. Lastly, there is litigation related to the ACA, and it's still pending. All right, so what are some health insurance options? So we'll start with private health insurance. There is certain periods of time that are important to enroll in health insurance. So open enrollment is something that happens in the fall. There's general open enrollment, usually between November 1st and December 15th. Some states like California have expanded their open enrollment. The dates aren't quite set for this fall's open enrollment, but these are generally the times of the year and where someone can change the plan, enroll in a new plan, and sort of shop around for plans. And the general open enrollment website would be healthcare.gov. For those who are in California, Covered California is the health market exchange for California. All right, so I mentioned the state marketplace insurance. That is where someone can shop for plans. And the plans that are available are organized by metal categories. So we have bronze, which is and you'll see in the images, it goes by percent of coverage. So bronze is a lower tier plan, has lower monthly premiums, higher out-of-pocket costs for care, and higher deductibles. Whereas the gold and platinum plans, which cover 80 to 90%, may have higher monthly premiums, but they could also have lower out-of-pocket costs for care and lower deductibles. There are tax credits available for lower premium costs if someone's income is between 138 and 400% of the federal poverty line. So what does that look like? I mentioned the tax credits. I wanted to show this table just to give an idea of the range of incomes that could potentially qualify for tax credits. So the table shows both 138% and 400% for an individual and a family. Some states that have expanded Medicaid, including California, may offer these tax credits. However, if someone's outside of this income level and they may not be eligible for tax credits, there are still options to shop off exchange. Okay. So I mentioned the health insurance marketplace as a potential avenue to shop or maintain coverage, but sometimes these other two laws may also come up. So COBRA is a federal law that allows someone to maintain coverage from employer-sponsored coverage if they have been terminated or have left their job. Usually, the requirement is for an employer of 20 employees or larger. If someone does choose to continue coverage under COBRA, it's important to note that the employee will be responsible for the full cost of the premium, and that can sometimes be somewhat expensive option. States also have their own mini COBRAs, and that's for smaller employers. So in California, it's called Cal COBRA. As you see, it's for employers with 2 to 19 employees. This one also makes an employee responsible for the cost of the premiums, or even slightly more than 100% than the premiums. However, sometimes COBRA can be an expensive option for some folks. So it's also possible to shop on the exchange for plans. And during this period called special enrollment. So special enrollment allows for generally 60 days to enroll for a qualifying life event. And that can be, say, losing employer coverage, moving, divorce. Those are some common examples. And also, since we are in the middle of the pandemic, some states have opened their exchange for enrollment. California recently extended their special enrollment related to the pandemic, and as of today, it goes through the end of August. Okay. So these last two insurance options are public programs, and I wanted to do a comparison of the two. So Medi-Cal, again, is California's Medicaid program. It is for individuals who are of limited income and limited resources. There are also some other categorically eligible individuals, such as the aged, blind, and disabled. And some states have expanded who can be eligible for Medicaid, and that's those who are up to 138% of the federal poverty line. Then there is Medicare. So Medicare is for those who are 65 or older, or who have been receiving SSDI for 24 months. And Medicare is structured, original Medicare typically included sort of Part A and Part B, coverage for hospital, and then coverage for medical. Part D is prescription, and Part C is a health coverage option run by a private insurance company that's approved by Medicare. They must cover all the services that original Medicare offers, but they have some slightly different rules and costs and restrictions. Okay, there's also a program known as a Health Insurance Premium Payment Program, HIP. Um, and this can help someone with premium payments. And essentially, it's at the state's discretion whether to enroll someone in HIP. A Medi-Cal eligible person can apply, and then it's up to the state to decide whether or not a person's health condition is whether it makes sense for the person for Medi-Cal to pay the premiums or to enroll the person in Medi-Cal. So this is another option to flag. Okay. And sometimes, there are the ways that I've talked about getting healthcare coverage may not be applicable. So there are some other options. First, there's private insurance through a company or a broker. Next, there is this program called Hill-Burton. Hill-Burton was a law which gave hospitals and other facilities money for construction and modernization. In return, those facilities that received the funds agreed to provide a reasonable volume of service to people unable to pay. So while the program stopped providing funds in the late 1990s, certain facilities are still obligated to provide free or reduced cost care. Someone can call the hotline to get a list of obligated facilities. There's also a separate number for Maryland. And lastly, there's charity care. Many hospitals have free or low cost care available to low-income patients. Reaching out to either a social worker or patient services department at the local hospital department can help see what options may be available. And yes. All right, so this last part is about health insurance appeals. The appeal system provides patients with the opportunity to present additional evidence of the medical need for services they're requesting. So before we get to appeals, it's also important to know that some issues, may be resolved without the need of an appeal. So common billing issues that can come up is an incorrect billing code used by a provider, prior authorization was required, something maybe would have been put as preventative screening versus diagnostic, double billing, or something was medically necessary or but wasn't sort of put as medically necessary. So those are some things to look out for to review bills to see if it's something that could be addressed, say, with a phone call, or if it's a billing issue. There are also some common medication issues. The medication maybe is not on the insurance formulary. So an insurance formulary is essentially a list of medications that the insurance company will cover at different percentages, usually tiered from low to high. So generic drugs can be in a lower tier, name brand drugs can be in a higher tier. If there's issues getting certain medication paid for, there may be pharmacies that can provide discounts or coupons. And then there's also the possibility of step therapy. Some companies may require step therapy, which is essentially having to try a less expensive medication first, demonstrating that didn't work before the insurance will pay for the medication that the doctor originally requested. Okay, so if something does have to be appealed, it's important to know some of these basics. So, so if someone has been denied coverage of a health insurance benefit, they may want to consider an appeal. Private insurance companies have different procedures for appeal. It can be regarding the denial of coverage and insufficient coverage. It's helpful to do an appeal in writing. And it's also helpful to involve a medical team. And one of the things to note about an appeal is to pay attention to the denial letter and also any dates and timelines put in to the appeal process. For Medi-Cal appeals, it's different. So they will contact the Department of Healthcare and Services. For Medicare appeals, it's helpful to contact the SHIP or HICAP office. It's a health insurance counseling and advocacy program for the state. And it's also important to note that there is the internal appeal with the insurance company, and if that's not successful, there may be an option for an external review. Okay. So an external review is an option generally once the internal appeal has been exhausted. It's an independent medical review in California, and it's done by a qualified individual without a connection to an insurance company. Here are some resources and information regarding health insurance appeals in California. For questions about the appeal process, whoever you contact in the state is going to depend on the type of plan that you have. So HMO plans and Blue Cross and Blue Shield plans can reach out to the Department of Managed Healthcare, and then all PPO plans can reach out to the California Department of Insurance. All right, so a couple of helpful resources. The Patient Advocate Foundation can offer services in case management and also with appeals. I wanted to include the links to the general health marketplace, health insurance marketplace, which is healthcare.gov, and then California's Health Exchange, which is Cover California. This next resource is California's list of hospital free and discount payment programs. It's a way where you can look to see what sort of financial assistance programs may be provided by hospitals in California. And the last office is the Office of the Patient Advocate. They can help in better understanding insurance policies and coverage. Okay, so that's it for the presentation. Any questions about today's presentations or a question about a specific situation, you can always reach out to the CLRC by filling out an intake at www.clrcintake.org. And just an additional information, again, our website, our telephone assistance line number, and our online intake form. And thank you everyone for your time and attention.